So smile makeovers with porcelain veneers. Take me through the process. Like, who's a candidate for veneers?
So basically, there are three categories of patients. One who has crowding or spacing, right? So we can fix the crowding or we can fix the spacing with porcelain veneers. The second is patients on whom the whitening is not working anymore, right? So the teeth are yellow, they've got done whitening over the period of years and it doesn't work anymore and they want white teeth. So they're the second category. And the third one is the patient who have flat teeth. Over the period of years, the teeth have been grinded down. We might have to fix their bite, but they are still candidates for doing veneers. So they are combo cases. We fix their bite and then we do veneers.
My question is, because I feel like sometimes I could spot veneers walking down the street. They look big and bulky. So how do you avoid that? And what's the process? Like, how do you know what it's going to look like? How does the patient know what it's going to look like before it's done?
Let me answer both of your questions. So one question is they look bulky. That's lack of planning, right? We don't do that. We have a digital smile design computer program in our office where we take a before picture and we design it on the computer to see how it's going to fit your mouth. So it takes all the factors, measures the size of your face, size of your teeth, size of the distance between your eyes, and gives us the exact size which would fit your face the best and give you the best smile you can get.
And you show them.
And we show them before and after, before we do the case. So
and what do they say when they see that?
They love it.
They go, I want that.
That's what they do. We email them the pictures, they go home, they show their friends, they show their girlfriend, boyfriend, whatever, they show their spouse, and then they come back and then they do it.
Is that right? So the turnaround time with porcelain veneers is what?
So if they don't need any bite correction or any other work, then it's only 10 days.
Okay.
They come in, we take the study models, we make the temporaries, we prep the teeth for the veneers, and 10 days later we put the finals on, and
which is
done.
A couple of visits, 2-3 visits. If everything
3
works
visits
out?
the most. 3 visits the most if everything works out.
And you do a lot of cosmetic dentistry. You said.
A ton of it.
You said a ton of it.
Yes, I love it. I love seeing the before and afters. It's very fulfilling. It's very rewarding to see the transformation. Patients spend thousands of dollars to get it done, but it's $1 million smile. You cannot put a price tag on it. It's amazing.